Niall Dickson is Chief Executive of the NHS Confederation. Good morning to you.
Good morning.
Good morning. Well, these figures, so they're always rather complicated because there's England and Wales, there's the UK, excess deaths, coronavirus, etc., etc. But taking it all out and looking overall, we're looking at 50,000 deaths from coronavirus in total now, and 14,000 other excess deaths unaccounted for, but which have taken place above the 5-year seasonal average. Huge numbers of those in care homes. Now looks like, on the figures we've got right now, as much as we can make international comparisons, the UK has the highest deaths per million population in the Western world. How concerned are you about how we have handled as a country this epidemic?
Well, I think that it's a mixed picture, to be honest. I mean, in one sense, we were told right at the start that the NHS would fall over, wouldn't manage to meet the number of cases, that we didn't have enough intensive care beds, we didn't have enough staff, and the system was already under huge pressure. And I think the health service has managed to adapt extraordinarily well and has shown its ability to flex and provide what was in effect a completely different kind of service, and they've done extraordinarily well under very difficult circumstances in running a COVID service alongside a much more limited non-COVID service. But the consequences even of that, of course, on people's health is very significant for the work that the NHS and other services have not managed to do during that time. I think the questions, the overall questions, I know government ministers say this all the time, well, we'll look at that when it happens, and international comparisons are difficult, and so forth. And, I'm in one sense happy to go on with that, and let's look at the position going forward rather than turn our heads backwards all the time. But the obvious questions will be, how quickly did we go into lockdown? How good were our stockpiles of protective equipment? How good were our distribution methods, and how prepared were we in relation to testing? So we know all the questions. We know that there have been difficulties in all those areas. That's absolutely acknowledged. I suppose I would say it would be better if an inquiry helped us to really learn where we were going, rather than necessarily dish out blame, which is what certain parts of society always want to do. And let's
learn the lessons for next time, because realistically there will be a next time.
There could be a next time next year. I mean, people talk about it as a once in 100-year thing, but it's a once in 100 years can happen 2 years running. So there's no doubt that we face the risk of another pandemic, and it could be a more vicious one than this. So we absolutely need to do that.
We've got other concerns as well, not just the deaths from coronavirus, particularly issues in care homes and obviously in hospitals, but also NHS waiting lists for all other treatments, whether it's routine operations like hip operations or the people needing cancer treatment. Waiting lists could hit 10 million this year. We already had a long waiting list. How quickly do you think that we can actually overcome those long waiting lists? How many years is it going to take?
I don't know the exact answer to how long it'll take. And remember, as you say, we already had unacceptable waiting lists of 4 million plus even before the start of this. I think our plea at the moment is, first of all, to politicians not to raise expectations. Secondly, to do a deal with the private sector. I know there have been talks going on in relation to this, but we need all the capacity we can get. We don't need ideology or anything else. We need to use whatever capacity we can get to try and get people treated. And the vast majority of patients, frankly, don't care whether they're treated in an NHS facility or a private facility, as long as the quality of care is right, and that, of course, the state has to be paying the right amount of money for that level of treatment. So our plea certainly is to do that. We also want to see, frankly, a bit less regulation going forward. We've seen how the lift of some of the bureaucratic processes have enabled local services to start doing things quicker. But again, I don't want to raise expectations either. The reality is running a COVID and a non-COVID service, maintaining social distancing, using protective equipment, having heightened infection control, all those things make it difficult just to keep what we're doing now running. And at the same time, we've got to start restarting services to treat areas, as you just described, like cancer, stroke and heart care. And remember also not just hospitals. Remember community services, GP.
Absolutely, vital. Niall Dickson, we'll have to leave it there, but thank you so much for joining us once again, Chief Executive of the NHS Confederation there.